scanning the room.
Hello, my name is Sarah New. I am a first-year nursing student at Williston State College, and today I'm going to be demonstrating how to reconstitute medication from a vial, pulling medication from a vial as well as an ampule, and how to administer an intradermal injection and an intramuscular injection. So I've just entered the med room, so I will perform hand hygiene. Before getting into the medication cabinet, I need to go ahead and compare my orders with my MAR. And our patient is Shirley Cost, birthday of 5/14/64. That matches our MAR. The doctor has ordered a PPD test done on the right arm, and that matches our MAR for a purified protein derivative, diluted 0.1 mil, and that's an intradermal injection given one time, and that's going to be given at 10:30. And I know that that is for testing for tuberculosis. Next, he has ordered ceftriaxone, 250 milligrams, intramuscular injection once daily, and that matches my MAR, to be given at 10:30. And to know that that is an anti-infective medication, so it's going to help treat her community-acquired pneumonia that she's been diagnosed with. Next, we have Phenergan, 25 milligrams, intramuscular, twice daily as needed, and that matches my MAR, and I know that that is for the treatment of nausea and vomiting. I also see that our patient has an allergy to codeine, and being familiar with these medications, I know that none of them contain codeine. If I were unfamiliar with any of my medication on the MAR or the order, I would go ahead and look those up in a drug book. So now I need to go ahead and do my first med check by getting my medication out of the cabinet. So first I'm going to be getting the PPD. It needs to be diluted to a 0.1 mil injection given one time intradermally. Okay, so we have our PPD, and it says that I need to mix with 3 mils of water so that I can pull out the 0.1 mil strength. All right, and that's going to be given at 10:30. So next we need ceftriaxone, 250 milligrams. That's an intramuscular injection once daily. So now I have the same thing here. It's the ceftriaxone, 250 milligrams per milliliter. So according to the label, I know I'm going to have to mix 3 mils of sterile water with this, and then I would pull out the 1 milliliter, and it is for IV use or intramuscular use. So, and I've checked both those expiration dates. They are not open yet, and they're not expired, so those are good. Get my sterile water. These are not expired. They have not been opened, so that's going to be to mix those. And next we need Phenergan, promethazine, 25 milligrams, intramuscular, twice daily as needed. And that matches our Phenergan. This is a 50 milligram per milliliter concentration, so I will have to pull up 0.5 milliliters to get the right concentration of 25 milligrams. All right, so excuse me, first med check is correct. Now I will don my gloves. As I prepare the medication, I will be doing my second medication safety check. Okay, so first we're going to go ahead and prepare the PPD. So I will locate that. And again, I need to add 3 mils of sterile water to reconstitute this medication, and I am drawing out 0.1 milliliters, and that matches. So we'll go ahead and get our sterile water. We're going to pop those caps. We need to go ahead and clean off the caps with an alcohol prep pad. And you would do this for 10 to 15 seconds. For recording purposes, we're going to cut that down a little bit. Okay. You need to make sure that alcohol is completely dry before injecting your syringe. All right, so first I'm going to get my 3 milliliter syringe. We're going to attach our drawing needle. Pull straight up, and since I need 3 mils of solution or diluent, I need to get 3 mils of air in this. So I will apply that directly down into the airspace. Up, make sure the bevel of the needle is inside the liquid. Okay. I'll just make sure there's no air bubbles before I mix that into my medication. It just helps for later. Okay, so now we will mix this to reconstitute the PPD solution. All right, so I will go ahead and activate the safety device on my needle and dispose in the sharps. Reconstitute this medication. You don't want to shake it vigorously, you will damage the medication and add air bubbles. Okay, a little bit more. Okay, so you can see that that's a good color, good consistency, so that's safe to use. We'll go ahead and get our tuberculin needle. And we need to draw out 0.1 milliliters of this, so I'm going to pull down to the 0.1. Okay. Uncap the needle by pulling straight up so it does not contaminate. Add my air. Whoop. Alright, so I got a little bit more because I see there's some air in there, so I'm going to go ahead and recalibrate that. Okay, so that is good to go. We'll go ahead and recap that since we're going down the hall with it by using the scoop method. Okay, we need to add our label. Make sure it's the right one, it's the PPD. Okay, and on that label you want to make sure you have the medication, the dose, your signature, and the date. And next I want to go ahead and mix up my ceftriaxone, 250 milligrams intramuscular injection, administered once a day. Our next dose is at 10:30. So I will find my ceftriaxone. It is a 250 milligram, and that's per mil, and it's according to the label. I need to mix 3 mils of sterile water. So to do that, I will get my 3 milliliter syringe. I'm going to use this drawing needle. I'm going to attach that, pulling straight. Oh, before I do that, I'm going to go ahead and pop these tops and clean them with an alcohol prep pad. Again, for 10 to 15 seconds in circular motions. For video purposes, it's going to be a little less than that. To 15 seconds, allowing that alcohol to dry before we inject the needle, pulling straight up on the needle to keep from contaminating it. Again, I need 3 mils, so we're going to draw down to the 3 mil mark for the air. Okay, add that to our airspace. Keeping the bevel of the needle in the liquid. Okay. And just get any air bubbles out of there. Okay, so we're going to go ahead and add that to our medication. All right, I'm still using this for when I draw out the meds, so I'm just going to set that in the cap for a minute. I'm going to go ahead and reconstitute this. Again, don't shake it vigorously. Just gently mix it so we don't damage the medication or add too many air bubbles. All right, grainy still. Okay, that's better. So we have good color, good consistency. I will go ahead and pull down 3 mils of air. I'm sorry, 1 mil, because we're going to draw 1 mil of solution of medication. Okay, so there's our 1. Again, adding that to the airspace right in the middle. Keeping our needle in the liquid. Bigger needle. Going slightly below the mark so I can make sure it's calibrated. Okay, so we'll get all the air bubbles out. And normally we would be over a sink, so I could recalibrate that to the 1 mil mark. All right, so again, there's no safety device on this needle, so I'm going to go ahead and recap it like so. And get my fresh needle. Okay, so we'll add our label, that is the ceftriaxone. Just add that to the cap. Gotta make sure the med is on there, the dose, the route, and the date, and my signatures and the time. Okay, and our last one we want to get ready is the Phenergan permethazine hydrochloride, 25 milligrams intramuscular twice daily as needed. And again, we have the Phenergan 50 milligrams, 50 milligrams per milliliter. So I know that I need to drop 0.5 mils of this medication. And before I do that, I'm going to go ahead and sterilize this. Wiping the bottle 10 to 15 seconds, making sure there's no medication up in the tip, allowing that alcohol to dry completely. All right, so we're going to go ahead and wrap it with a piece of gauze. We will pull towards me to break the cap, and then you want to dispose of the cap and the gauze in the sharps container. So we're going to set that there. And for this one, we're going to need to use a filter needle in case there is still any glass in it. Medication on me. Alright, so here's our filter needle. And you don't add air to this one. I'm just going to pull straight up. Make sure that's at the bottom. And you want to go in, you don't want to touch the rim of the ampule so we don't get any extra glass in there. Okay, we're just going to pull up, make sure we get enough of the medication in. Look for any air bubbles, get those to the top. Okay, so I will calibrate this after I put my fresh needle on, so just go ahead and get rid of this drawing needle. Okay, so we'd be over the sink and we just calibrate that to 0.5. All right, so that medication's ready. Let me label it. Okay, again with the medication, the dose, the route, the date, the time, and my initials. All right, vinegar needs to go in the sharps container and clean up my workspace. All right, these are multi-use vials, so I'll make sure and put the date, the time, and my signature on them before putting them back in the cabinet. These are single-use vials, so I will throw those in the garbage. Okay, locking my cabinet, and now we're ready to go to the patient's bedside. Okay, so we are now in the patient's room. I would have taken these gloves off in the bedroom and washed my hands, so I'm in the patient's room. Hello, Miss Shirley. My name is Sarah, and I'm going to be your nurse today. The doctor has ordered some medication, so we're going to have to give you a shot in each arm and a little poke in your forearm. The shots in the arms, one's going to be to help that nausea, one's going to help to fight the infection, and the one in your arm is just going to be a tuberculosis check, okay? All right, so first we need to get the sites ready. So to find that, can you tell me your name and date of birth, please? Okay, thank you. That matches. And do you have any allergies that you know of? You have an allergy to codeine? Yep, we have that marked, and none of these medications have codeine in it, so you are good. These gloves are a little sticky today. So, okay, let me just check your armband. All right, it says you are who you say you are, so we're going to go ahead and do our third med check at the bedside. First, I'm going to go ahead and give you that shot in your arm of the Phenergan. So let me just find it in my tray. All right, so that's the promethazine, 25 milligrams, 0.5 mils, and that has been ordered to be given twice daily as needed. And 25 milligrams, everything matches on there. So to find our injection site, we will find the acromion process and go down 3 finger lengths from there. So that's going to be right here in the deltoid muscle. And the skin looks good, muscle feels good, so it's safe to get it there. We will prep the injection site by cleaning from the center and working our way out 2 inches. About 10 to 15 seconds for that as well. And allowing that alcohol to dry. All right, so I'm going to hold some gauze in my hand. Pulling straight up on the cap. We are doing a Z-track injection. So to do that, I'm going to hold to the left of the injection site, pulling over. Normally I would raise this bed up, but this is not a regular bed, so I'm just going to have to squat a little bit. So you hold over right next to the injection site, go in at a 90-degree angle, a swift dart-like movement, and then we hold steady with our non-dominant hand, inject slowly. And normally we would hold this here for about 5 to 10 seconds. And pull out, press, engage your safety device. I should have a sharps container next to me, so normally I would dispose of that right away in it. Okay, so we'll go ahead and put our Band-Aid on our patient. Okay, so I'm going to cover that up, and next we would normally be injecting another intramuscular injection of the ceftriaxone, 250 milligrams, and that matches our MAR, and that would go in her other shoulder in the deltoid, but just for video purposes, we're not doing that. So I would dispose of that in my sharps container. Okay, so now we need to do our final injection. This is an intradermal injection, so it's going to go in her right ventral forearm. So you want to assess the area, make sure no bruises or lesions or anything, and the veins look good. So we would prep that site. So we're going to be using our little practice skin for that. So to prep the site, let's get this stuff out of here. Okay, so you want to prep your site, start in the center where the injection is going to be, and work out about 2 inches, allowing that alcohol to dry. we'll do our third check of the PPD, 0.1 mils to be given once, and that matches our MAR, so this is safe. So I'm gonna go ahead and pull that up, dispose. So to do this, you wanna go ahead, pull the skin nice and taut, go in at a 5 to 10 degree angle, go just under the skin, pulling up slightly so you can see that bevel. Hold steady with your other hand and form a little wheel, pulling straight out. All right, so we would engage our safety device for that as well, dispose in a sharps container. And we want to go ahead and write a circle around this. And then you would date and time that so that we can be testing that in 2 days to see if it's a positive reaction. All right, so make sure you don't scratch it or itch it or anything, okay? We need that medication to stay right there under the skin. Otherwise, we'll have to do it again. So just dab up any extra medication. Okay, so I'm gonna go ahead and doff my gloves. I would dispose of those properly, perform hand hygiene, make sure Shirley has everything that she needs before I go, and also go ahead and document that those medications were given at the appropriate time. Sign, title, initial. Okay, and that's it.